Hello everybody, Suzanne with Dawning Visions Hypnosis, here to speak to you, mental health clinicians, about being forced to work with patients who are not progressing and how frustrating that can be. I never really worked in a situation where I was forced with people who I didn't want to work with, except for maybe my very first, shall we say, professional mental health program. However, there were almost 200 people walking in and out of the 4 programs that were servicing them throughout the day, so there were many people for me to interact with, to say the very least, and it was truly a place where I worked to learn the foundations of having appropriate boundaries, as well as how to work with people who had very significant mental health issues. And in many cases, it was a wonderful, wonderful position. I enjoyed it 99% of the time. There were those times when I had hard people that I was working with. One who was a really sweet man, except for when he went psychotic and thought he was Hitler, and thank God he never knew I was Jewish, because that could have been a problem. However, these are the things that you learn how to deal with in such situations. Long ago, though, I chose to not go for a license working in mental health because there were just too many policies that I did not agree with, and I didn't want to be handcuffed by the associations for things that I truly do not believe cause any problems whatsoever for the client-clinician relationship. However, they can cause some problems in terms of, shall we say, putting the clinician on a, higher level than the patient, which never worked for me, either as a patient or as a clinician, not really. We need to understand that they are at least 50% of the outcome. And if they are not interested in doing the work, if they are not invested in showing up, if they are not invested in learning what they need to learn, the patients are not going to move forward. And this can be really, really frustrating. So after working in a few agencies where I actually despised my directors of the programs, it wasn't the clients. The clients were fine. It was the directors of the programs who were very demeaning and very even infantilistic toward the clients, never really understanding that for people to grow and develop, which is what the job was to help people grow to the degree that they could, that they were never going to be able to grow. And so I left that entire type of work to be able to start my own practice in hypnotism and neurolinguistic programming, which has worked out a lot better for me, and most especially for my clients, because they have actually healed. Most of them have totally overcome their diagnosis. Many of these diagnoses that the conventional mental health world would say are totally impossible to overcome. And I'm here to tell you, after 20 years plus in this business, the conventional world really doesn't know what the hell it's talking about. Not really. Because I would suggest to you that if someone is symptom-free for 18 years or more, that they are healed. In physical health, we would consider them healed. So why this can't be true mental health is quite the quandary. And because of this whole idea of pathologicalizing every single normal, natural emotion, as the DSM-5 and DSM-5R do, this isn't really a practice that I believe in. I believe that all people have within them the ability to heal to the degree that they're able to heal, And though we cannot help those with psychotic features, and we cannot help those who have really true personality disorders and those who have a IQ of 70 or less, we can work very effectively with kids because they are in a natural trance state until their prefrontal cortex totally develops at 25 or 26 years of age. The rest of them, we can help. We can help them overcome these problems. We can help them move on with their lives, and that's what they would love. And I do believe that anybody who is in this business would want that for their patients more than anything else. Otherwise, why be in the business? Why? I'll tell you, I got a message from a client of mine who I worked with when I first got into this business. It was a year into my practice. I had done a lot of hypnotism, and I had just learned how to do neurolinguistic programming. And it was a very, very challenging case, let me tell you. The doctor who is the editor of the mental health newsletter at Mass General Hospital couldn't help her. Her physical doctor couldn't help her at Mass General Hospital, and it was finally understanding that psychosomatic pain was coming from really deep anxiety from childhood trauma that we were able to release that helped her. 17 years later, when she got out of the relationship, well, actually, sadly, the gentleman with whom she was in a relationship, who had some significant mental health problems of his own, passed away of cancer, and now she's living with a much better partner in life and is having a really, really happy life. And she thanked me for helping her to make that happen. 17 years later. Because sometimes even our patients have to do the right thing. And in this case, this man had helped her out significantly financially for many, many, many years. So I believe she felt that she owed that to him, despite the abusive nature he could have at times with her. So we need to really think about what we're doing, why we're doing it, and how we can do it better, and get payments that make sense for us to be able to live our best lives. Because when we're living our best lives, then we can certainly be a much better help to our patients living their best life. But to do that, we need to have invested, interested patients with which to work. They have to want the help and do whatever it takes to receive the help, as this past client of mine did. If you're interested in learning how to integrate hypnotism and neurolinguistic programming, which is what I believe are the ingredients that are missing from the conventional mental health educational process, sadly, I will leave my contact information in the description box below so you can contact me regarding that. I only take on one trainee a week because I have to give 12 months of mentorship to all the people who I train, so we can't overload this. But it is a program that my trainees have found amazingly effective. I have one trainee who got totally out of the practice of medicine. She was a PhD psychologist, and she wanted nothing to do with the medical world anymore and became a coach instead, charging a lot more money to work with her ideal clients at this point. And she's really doing a great job, just for one person who's doing really well, and I'm really happy with the work that she's doing. I also retrained another person who had taken neurolinguistic programming from somebody else and could not get the results, and he's doing really, really excellent work now with his people as well. It's just two cases of people that I've worked with, just to give you an idea of what is possible when you decide to learn the tools and techniques that actually help your patients heal, and for which they will pay you a lot more money to provide to them without having the hassles of the insurance companies, because they're a pain in the ass and we all know it. Well, that's all I have for you for today. Thank you so much for spending your time with me. Till next time. Bye-bye all.